So maybe before you share the presentation, I'll just briefly start. My topic is, as you mentioned, coordination of transition of care. My name is Karolina. I am a clinician from the Czech Republic and also the head of operations in Parent Project Czech Republic, which is a patient organization that is focusing on helping patients with neuromuscular diseases, especially Duchenne muscular dystrophy in the Czech Republic. Why I chose this topic? I think transition of care is extremely important. We made a questionnaire a couple months ago asking patients about what words come to their mind when you say transition of care. And unfortunately, the results were very alarming. We heard fear, uncertainty, afraid, desperate, and so on. So we do know that it's a big concern in our patients' minds. And the project that we started is called Coordination of Transition of Care, because what we found out is that what they really need is just someone who will ask them good questions about what they need and who will focus on building a network of specialists who can take care of them.
Karolina, so sorry, I seem that I don't find your presentation. Did you send it by email?
Yeah, I sent it twice, but okay, I'll just try to
Maybe
share my screen.
Or if you can send it right away, I will just open from my laptop.
Okay, I'll do that.
Yeah. Sorry about that, but I know I've searched it already earlier today just to see if you sent the presentation, but maybe I didn't receive the email. So
I send it to you now. Okay. The situation in the Czech Republic is such that we have absolutely excellent pediatric care of neuromuscular patients. It is really world top. But when the patients turn 18 or 19, what they get is just one name, one email, one person they can turn to, one neurologist who really doesn't have time to take complex care of the patient, who asks them about new problems that they have, asks them about the need of a wheelchair, gives them corticosteroids if they need it, and that's it. And the neurologists really don't have the capacity, the time to take care of those patients in a complex way. And really, ever since we have so good care in pediatric system for our patients, we have a population growing of need, a population of adult patients that we didn't have before, especially of Duchenne muscular dystrophy. So, and you might all know that really this disease is extremely complex, and especially when you get older, the problems that come up with your heart, with your lungs, the needs for sleep studies and for ventilation and for cardiac medication and like a GIT tube, gastrostomy. Those are very specific needs that not everyone really understands, not every doctor. And the experience with Duchenne patients is very low in the Czech Republic, especially. We're a small country. So what we've came up with, yes?
Sorry, I still didn't receive it. So maybe it is a problem still with my email or anything, because it didn't came. Okay. Can you very, very quickly forward it to the email you see in the chat? It's our IT team there. Okay. And they can do it.
Okay.
So
I will do that.
Yeah. So this one, yeah. Or if you think you want to try to share your screen again, but I don't know if the connection will be then. It's interesting because I've received your emails, but not a presentation, so I don't know why.
I don't know either. Okay. I send it to the email. So in my presentation, I briefly speak also about our organization. What we offer to our patients overall are stays, week stays, weekend long stays, where they can meet other families and also a team of experts. We also offer mobile care. We come to our patients to their homes and discuss with them their needs. And we have a lot of telemedicine projects working online and over the phone. And so the role of coordinator of care is really what it looks like is that the pediatric center contacts me as the coordinator when the patient is turning 18, let's say, and they tell me, okay, the patient will come in and we will examine him for the last time, and then they will have to transition. So they'll be yours. And I come and meet the family and discuss with them what their life looked like until now, and what was like a big issue that they needed. Thank you for sharing it. So we can move maybe 2 slides or three slides. Yeah, and next. Yeah, thank you. Thank you. Yeah, that's a good slide for me. So what I do is I contact the family, I talk to them, and they told me that, for example, the patient has a lot of problems with their lungs, they need ventilation, or another patient is more needing of cardiac care, or someone else has problems with nutrition. So I really try to do individualized care and really just focus on the area that is most needed for them. And then we come up with what suits them in terms of appointments. I ask them if they are able to come once a year to a hospital to have an appointment, if they all need the appointments in one day, or if it's okay for them to have it in 2 or 3 days. And then we work with that. And what works really very well is that they know that I'm one clinician that knows them, knows their story, and they can call me if they need to, and I will know what is behind their story, and I'll know more. Of course, really none of the other doctors have the time capacity to take care of them in this way. And I think it helps the doctors as well to have one coordinator, because the coordinator can also discuss in acute situations. And when the family calls me and tells me we have this kind of problem, a fever and arrhythmia or something, we can talk it over within 2 or 3 minutes, and then come up with if they need to go to the hospital, if they need to go within 10 or 20 minutes, or if it will wait for a few hours, or if they should just wait to the next day, and what they can do. So we do kind of a triage situation and discuss with them. And they feel much calmer because they can talk to someone who knows them and who knows neuromuscular patients. So I think it's a system that works for the families especially. But as I write here, I also try to build a network of specialists who will take on those patients, and it's a good position to be coming from a patient organization, not to be a parent, but to be someone officially from a patient organization, and come asking for this kind of solution and asking for cooperation. And rarely anyone says no, actually. So that's really good news that we have seen just a lot of positive reactions. And if I give the doctor some numbers of how many patients they will take on or so, then they usually calm down, because if I ask them to take care of Duchenne patients or neuromuscular patients, they imagine a few hundred of patients, which is definitely not possible for them. But if I tell them it's usually 10 or 20 patients per year, then it seems doable much more. Next slide, please. So this is a picture from our stays. It actually helps a lot to meet the families in person at those stays, or of course, when they come to the hospital, at their hospital appointments. And what I also mentioned here, that not only in this project do we take care of patients who are transitioning, but also of patients who are already adults but do not have complex care. So if they they sometimes have very to me simple issues, for example, or it seems simple, they don't have an eye doctor. They don't really need a special eye doctor for neuromuscular disease, but they don't need an eye doctor where they would have accessible examine rooms. So this is something that I really can solve much easily than anyone else. I can ask other families where they go, and then call the office and just ask them if this patient can come. So the families are overwhelmed with so many information and so much to do. And just one person of a coordinator can help a lot, making those phone calls and helping them to organize the appointments. What is also great is that I have much more time to discuss with patients the treatment, why they can or cannot join a clinical trial, what it means, what they can expect from research, what they can really expect from the future of these diseases, and what they should prepare for. So we have much more times for discussion, and that's, I think, also crucial for the family. Next slide, please. I also put here some numbers. So in Czech Republic, we have about 300 patients with Duchenne muscular dystrophy, about 400 of children's neuromuscular diseases. We, of course, have other organizations taking care of neuromuscular patients. So, but if the patient really contacts us, what we provide them is specialized care, individualized care, if it's in our capacity, and it usually is. We have about 150 members of Parent Project Czech Republic, and about 20 families are part of the coordinator's care, but it varies also. Sometimes someone reaches out only once or twice, so I don't really count them as part of this project, but it's from my point of view, it's just good to know that you have someone to call in case of trouble or need. We have been doing this project for 3 years. We started with only 5 families, with 5 people who are transitioning that year. And we have about 10 specialists that joined our adult care team since. So I think that the network is really building up, and that it just helps the patients a lot. What is also interesting is that sometimes the coordinator's care is needed only in the beginning. So you just set up a system in the beginning, and the family knows that someone discussed it with them, that the care is set up, that they have a cardiologist, that they have a pneumologist, endocrinologist, and so on. And then they are already fine calling there, making appointments themselves. So they don't really need the care throughout the whole life, but in the beginning, very much so. Next slide, please. So this is just an overall information on how to start. I really want to encourage you, if you feel that there's a need in your community that is unmet, try to come up with innovative ways to solve it. It took us a long time to find out what works the best with our families, but I think that we're on a good path now, and it was all worth it. And to us, it is very frustrating that we cannot change the adult care system in a few months, let's say, and that we cannot build an adult complex care in the Czech Republic straight away. But this is a solution that is temporary, and that is helping the families now, which we're very grateful for. Of course, it's not easy to try to find financing for your project, but also there are resources to look into, and a lot of, for example, pharmaceutical companies are willing to just like help you start with an idea that you have. And of course, our ultimate goal, as I mentioned, is building an adult complex care center. So that's what we're working on in the long term. But the coordination of transitional care is really like right at the moment solution that we have. I think it's the end of the presentation, and I'm just glad I could share this project with you. And if you have any questions or want to ask about experience or about what we did and how to implement it in your country, then you can write to me or tell me your question now. Thank you.
Thank you very much, Karolina, for sharing this. And yes, we are open for your questions or comments.
One comment and one question. One comment, it's great. I really love it. I hope you'll be able to have more and more coordinators accompanying more and more families, because I think that's really a very important way to make sure that patients are able to have all the support they need and all this coordination, as you said, because that's really needed. Just a question, in the accompaniment or coordination, do you implicate psychologists, and is the access to psychologists easy or difficult in your country?
That's a wonderful question. We have 2 psychologists as a part of the team, 1 psychologist and 1 psychotherapist. What is very interesting for me is that when people join Parent Project Czech Republic, they all say that they need psychological support. They all mention it really in the first phone call. Everyone does. And then when I give them the number, they never call. Like really, like one in 10, not really 1 in 10, just that they just don't call. They don't reach out. So I think that when it's not like handed to them and like push on them, they don't accept it well, because they feel that they don't need it, even though they probably don't know what they're missing. We do psychological work with our families at the stays that we organize. We do them with the parents, with siblings, with patients. And that works really well for us, because it's in a form of discussion or even play for the kids. But whenever you call it psychological support or a consultation with a psychologist, no one really reaches out. So it's hard for us. But we actually hired one new person in our team who has experience with palliative care. And she's not a psychologist, so she is a little free in the rules of how to make connections with patients, and it works much better. So if she doesn't introduce herself as psychologist, and if she's part of the hospital already, so if she meets with the family in any other way, then it opens the door for next cooperation with her. So yeah.
Okay, and another quick other question. In France, we don't have a similar system, but we also have professional accompanying the family in all their need to also for inclusion in school, access to university, access to employment. And what we realize is that it's very hard to sustain and to maintain financially when it's just on a small number of patients. So in France, we do it for all neuromuscular diseases, and we try to convince the government to open it to all situations where people have some kind of dependency. So even elder people, Alzheimer, etc. How do you see it? Do you plan to open it to more pathologies, more all neuromuscular diseases, maybe other kind of rare disease?
That's a good question also. As we get better in our work, of course, more patients come to ask for help. What we really work on in the long term is advocating for case manager kind of situation in the Czech Republic, which is not available now, but we really have right now a questionnaire, a research going on to find out just how much it would be really needed to have case managers and like individualized care. So that's what we're aiming for in the long term. But in terms of financing, and it's very hard to just look into like big grants, and we have a lot of patients coming in, of course, but as of now we can handle it. And also what is helping is the community sharing. So we just started a community that will be on the website, like a discussion, open discussion kind of thing. And when the parents share their experience, it's also so valuable, or the patients, of course. So if it's a little like organized, and if it's not like where do you go to the movies kind of questions, then I think it works well as like inspiration to other families, and sometimes questions get solved there without the experts needed.
Thank you very much. Just I've got a contact with SMA Czechia, so if maybe there could be some kind of collaboration with the SMA population, I think this could be done.
Yeah. Okay. Sounds good.
Other questions, comments?